5 reasons why I perform a bedside ultrasound for my patients in my office. Number 1 is if there is an abnormal thyroid palpation based on my clinical examination. It helps me to look at if there are nodules, if there is an enlargement, which is also called as goiter, or if there is asymmetry, that is, one side is larger than the other, or vice versa. Number 2 is already having a diagnosis of thyroid nodules on an imaging done outside. I perform a bedside ultrasound so that I could look at the dimensions of the nodule, the architecture of the nodule, the characteristics, which are basically ultrasound characteristics, which helps me to determine if it's a low suspicion, moderate suspicion, or a high suspicion, and then decide about fine needle aspiration. Number 3 is vascularity. In patients who have Graves' disease or hyperthyroidism, performing an ultrasound at bedside helps me to understand what their vascularity or blood flow in the thyroid gland is. It could be widespread throughout the gland versus it may be very focal in that specific nodule, which is hyperactive or toxic nodule, or there may just be normal or scant blood flow, which does not suggest hyperthyroidism. But remember, hyperthyroidism, the diagnosis is based on blood work. Number 4 is in individuals who are complaining of a neck lump and not sure if the lump was felt on the right side, left side, or right here where your thyroid gland exists. That helps me to reassure that it may be a thyroid enlargement or a thyroid nodule, or it may be something on the other side, either side of the neck, which could be a lymph node or could be any other enlargement, or maybe a cyst which has been resolved. So it's very important for me to perform a bedside thyroid ultrasound and give answers right away to my patients rather than waiting for days or even months to get the ultrasound done. Follow along as I share more thyroid insights with you.